How to reduce facial swelling. Facial swelling can occur for a variety of reasons, including allergic reactions, dental work, and medical conditions like edema. Most facial swelling is minor and can be treated with an ice pack and elevation. If you are experiencing severe swelling, see your doctor immediately. Treating facial swelling. Use an ice pack. Applying cold to a swollen area can help reduce inflammation and pain. You can either wrap ice in a towel or use an ice pack and press it against the swollen areas on your face. Hold the ice pack against your face for 10 to 20 minutes. You can use an ice pack multiple times each day for up to 72 hours. You can use an ice pack multiple times each day for up to 72 hours. Elevate your head. Keeping the swollen area elevated can help reduce swelling, so keeping your head up can help. During the day, sit with your head upright. When you get ready for bed, position yourself so that your head will be elevated while you sleep. You can place pillows behind your back and head to angle your upper body back against the headboard. You can place pillows behind your back and head to angle your upper body back against the headboard. Avoid hot things. When your face is swollen, avoid hot things for at least 48 hours. Hot things can increase the swelling in your face and make the inflammation worse. This side effect of heat means you should avoid hot showers, hot tubs, hot baths, and/or hot packs. Try a turmeric paste. Turmeric is a natural remedy believed to help reduce inflammation. You can make a paste by adding turmeric powder or freshly ground turmeric to water. You can also mix turmeric with sandalwood, which also is supposed to help inflammation. Apply the paste on the swollen area of your face, making sure to avoid getting it in your eyes. Leave the paste on for around 10 minutes. Rinse it off. Then, press a rag covered with cold water on your face. Leave the paste on for around 10 minutes. Rinse it off. Then, press a rag covered with cold water on your face. Wait for it to go away. Some facial swelling will go away on its own, especially if it is connected to minor injuries or allergies. You just have to be patient and deal with it until then. However, if it doesn't change or get better within a few days, go to the doctor. Refrain from taking certain pain medications. If you are experiencing facial swelling, don't take aspirin or other NSAIDs to help with any related pain. These types of over-the-counter pain relievers can cause your blood not to clot properly. This inability to clot can lead to bleeding as well as increased or prolonged swelling.